We have been doing a number of studies with the RHA products. I've been using it since probably 3 or 4 years. The studies that we're doing presently, we're using the RHA1 for treatment of lip lines. It's part of the critical study for their acceptance in the United States by the FDA. And I'm also doing a small investigator-related study with Dr. Ingalina and my colleague Dr. Wong. We're using the RHA4 products for a new technique that we found is very useful for volume, particularly in the cheeks. And we're going to probably publish this shortly. So one of the advantages of the RHA line is that you can use these in areas, the dynamic areas of the face, and have a totally natural look. Patients are very concerned that they want to have a natural look, and now with this new line of products, we're able to give that to the patients, in that you can put them in areas where there's a lot of motion and they don't get that unnatural look that you often see walking down the streets. So the difference in the products that are, the RHA1, for example, is a product that we use on lip lines. It has a product that is a lot of stretch to it and is very useful because we can inject it very high up into the dermis, whereas the other products we wouldn't be able to do that because of the problems with lumps. So the products integrate very nicely into the skin without creating ridges. And then we have the RHA2, 3 and 4. The 2 is, we can use a little bit deeper. 3 and 4 are used for volume replacement. The 3 can be used in the superficial fat compartment, and 4 can be used in both the deep and the superficial compartment. Yes, I do. To be frankly honest with you, when I first started with the products, I was a little disappointed, in fact, but that's because you have to learn to drive slightly differently with the RHA products. By that I mean that if you just take the RHA products and try to replace what you were using before, for example, taking RHA4 and using it in the place of Ultimate, for example, you didn't get the same results. And the reason being is that you have to actually inject the product more superficially, which we're not used to in some cases, and there you get the results. And in fact, I've often found with some of the younger individuals that by doing that, being able to come up higher in the skin, you can actually use less product to get even better results. So it is actually, I never thought I would say this, but it's rare that I use any of the older line of products. I still use the Ultimate when I have a patient who has quite a heavy degree of atrophy in the cheek, in the 50 to 60 or higher age group. I still like that product there. And I will still use Global Action sometimes, for example, in glabellar lines. But overall, my practice has really changed, where I have a whole bunch of the previous lines still sitting around in my office, and I'm going through the RHA products. I think that the secret of this product is that it has stretch. But when you use the products, the previous hyaluronic acids that we had, they had strength, but they didn't necessarily have the stretchability which occurs when you, for example, smile or laugh or whatever. So often patients that had previous fillers would complain that when they smiled that they had an unnatural look. And as I mentioned, one of the beauties of the RHA product is that when you inject even a bolus in the cheek area, you don't feel the product, so it integrates very well into the tissue. And then when you have the movement, it's the superficial fat component that's tending to move more than the deeper area, so that when you inject there, the product doesn't move as a mass, it actually stretches out and then has the ability, when the skin is relaxed, to return to where it was before. So it's the ability probably of the stretch that is the important change of this kind of a dynamic filler for injections for patients. the answer is that there is some changes, that there are some products that I find that you want to use when you have severe atrophy of the skin. Then sometimes I will go back to some of my previous products that I used to use, mostly like the Ultimate or Ultra Deep. So in the older age group with dramatic hollowing of the cheeks or the area here, I may want to, oftentimes we'll put a base of Ultra Deep or Ultimate, just because it's a harder material and I get more lift with it. But overall, in most areas of the face, other than significant atrophy, I really am now favoring just using the RHA products, because I have that flexibility. I have that flexibility to go a little superficial, a little more deep. So I'm just getting it's my workhorse, if you will, that I use now routinely.